Representative Kathy McMorris Rogers and Senators Maria Cantwell and Patty Murray. My name is Casey Fowler, and I'm a nurse practitioner in Spokane, Washington. And as one of your constituents, I would like to bring a disparity in primary care and skilled nursing facilities to your attention. This occurs in U.S. Code Title 44, Chapter 7, Subchapter 18, Part A, Section 1395I-3, Subsection B6, which requires that all care in skilled nursing facilities be overseen by a physician. This policy is further delineated in the State Operations Manual, Appendix PP, Section 483-4, titled Physician Services. This policy states that all care in a skilled nursing facility must be overseen by a primary physician, and that a physician must personally approve admission to a skilled nursing facility. It further specifies that nurse practitioners may only practice in skilled nursing facilities under the direct supervision of a physician. This requires that an on-call physician be available in the absence of the primary physician, and it requires that physicians visit skilled nursing facility residents at predefined periods of time. The problems with this policy are that they don't take into account the resident's rights to choose a primary care provider. If a resident of a skilled nursing facility wanted to choose a nurse practitioner under this law, that resident could not do so. Additionally, this policy was written at a time when the role of the nurse practitioner in skilled nursing facilities was not well understood. Nurse practitioners are allowed to practice to the fullest extent of their licensure and state practice acts in other long-term care settings, such as assisted livings. However, in skilled nursing facilities, we're still restricted to practicing under the supervision of a physician. This policy also does not take into account the literature that shows the improved patient outcomes and reduced hospitalization rates and improved patient satisfaction with the use of nurse practitioners in skilled nursing facilities, but it restricts nurse practitioners from having the full impact by requiring working under the supervision of a physician. Additionally, this policy prevents nurse practitioners from working to the full scope based on their state practice acts. For example, in Washington State where I work in an independent practice state, which says that in other primary care settings I can work independent of the supervision of a physician. However, this law makes it to where I have to work under the supervision of a physician in skilled nursing facilities. Additionally, with the enactment of the Affordable Care Act, I'm sure you're aware of the shortage of primary care providers in this country. And requiring the supervision of a physician prevents nurse practitioners from going into areas where there may be physician shortages and physicians unwilling to supervise nurse practitioners. In addition, it creates redundancy where a nurse practitioner has to work with a physician, so two providers are involved in the care of a resident where only one is required. So eliminating this policy will help to provide more access to primary care for these residents where access may otherwise be unavailable. So my recommendations for this policy is to change the language to make it more provider neutral, or to at least make nurse practitioners equal partners in primary care and skilled nursing facilities with physicians rather than in a supervisory hierarchical type system. This will provide more opportunity for collaboration among colleagues rather than a supervisory relationship in which the physician dictates the care to be provided. Updating this policy will allow skilled nursing facility residents to have more freedom to choose a primary care provider of their choosing, which may include a nurse practitioner in some cases. This will also allow nurse practitioners to practice to the fullest extent of their training and their state practice acts. Thank you for your time, and I hope you'll give this full consideration.